Hello, my name is Justina and my partner's name is Sydney, and we are both going to be talking about iron deficiency anemia and runner's anemia. Iron deficiency anemia is a common type of anemia. It is a condition in which blood lacks adequate and healthy red blood cells. And as the name implies, iron deficiency anemia is due to insufficient iron, which is a very important component to oxygen binding proteins. Iron deficiencies are associated with an alteration of the transport and the delivery of oxygen to the tissues, which blood lacks adequate healthy red blood cells and could possibly affect athletic performance. On the other hand, runner's anemia is a mechanically induced hemolytic anemia resulting from the pounding of feet on pavement or foot striking. A manifestation of this syndrome is plasma volume expansion in the presence of mild hemolysis. Runner's anemia is a specific condition that can be an indication of one of three things, which is low iron, low hemoglobin, and low ferritin. There are several causes for iron deficiency anemia and runner's anemia. First cause for the iron deficiency anemia is blood loss. Blood contains iron within the red blood cells, so if you lose the blood, you lose some of the iron. That's why slow chronic blood loss within the body, such from like peptic ulcer, that can cause an iron deficiency anemia. A lack of iron in your diet can also have a great effect on your iron deficiency because your body regularly gets its iron from the food you eat. So if you consume too little iron, over time your body can become iron deficient. Third thing we have is the inability to absorb iron. So iron from food is absorbed into your bloodstream in the small intestine. And then any intestinal disorders such as celiac disease that can affect your intestinal's ability to absorb the nutrients from the digested food, which eventually leads to iron deficiency anemia. For pregnancy, without iron supplementation, iron deficiency is going to occur because pregnant women they need the iron source to serve their own increased blood volume as well as be a source of hemoglobin for the growing fetus. For the runner's anemia, some of the causes are endurance sports, foot strike hemolysis, intense workouts, iron loss through sweating, and menstruation. The causes for hemolysis are mechanical injuries, all due to the forceful ground contacts. There's also some causes due to metabolic disturbances such as hyperthermia and hypoxia. Hyperthermia is when you have an abnormal elevated temperature, and hypoxia is when you have a lack of oxygen content in your body. And that's why endurance runners are more likely to develop this kind of anemia because intense workouts increase the body's production of hepcidin, which is something that blocks a person's system from absorbing iron. This combined with the iron loss through the sweat and menstruation when you're exercising, that put the endurance runners at risk from runner's anemia. Some common symptoms and effects of runner's anemia on athletes are constant persistent exhaustion, so they won't be able to exercise as much, low ferritin levels, which can lead to high blood lactate levels. Sometimes runners' limbs will feel heavy, which causes tight muscles, and this slows the recovery from workout and injuries. And lastly, they might experience low motivation and reduced endurance, so they don't feel like exercising as much as well. Similarly, iron deficiency anemia causes athletes to have extreme fatigue, which decreases performance. They also might experience weakness, which leads to reduced endurance, and they might not be able to perform at their optimal level. Also, they might experience some chest pain, fast heartbeat, shortness of breath. Some of them might be lightheaded, dizzy, have constant headaches, and they might even have some cold hands and feet. Also, iron deficiency anemia can increase their like inflammation or soreness of the tongue, and they might have poor appetite, and this would decrease their intake of proper nutrition to meet their body's demands.
Hi guys, so I'm going to be talking about treatment. One way for treating anemia is eating iron-rich foods. We're going to go into more detail of this in the next slide. Another way of treating it is nourishing your spleen. The spleen is responsible for red blood cell production, and a healthy spleen is one of the primary factors that will cause anemia. We also want to avoid fast food, junk food, or processed foods, especially items that contain excess sugar or anything that can cause candida. It should be reduced or eliminated completely. Oftentimes, candida and anemia have a link to each other. If you ever take a look at your tongue or the back of your throat and notice a white color, that's candida. And another way of treating anemia is having proper digestion, eating a balanced diet, staying hydrated, engaging in regular physical activity, and stress management are a few ways of improving digestion. Anemia and iron deficiency is commonly associated in digestive diseases, so we want to take those preventative measures. One of the biggest factors as well as for treating is having proper footwear. Too soft or too hard of a sole can be detrimental to shock absorption. Having a good medium hardness of the shoe sole is recommended for optimal shock absorption. So as I mentioned in the previous slide, we're going to be talking about more iron-rich foods that you could take. Once again, the spleen is responsible for red blood cell production, and it's one of the primary factors that will cause anemia, so you want to take care of that. We would want to incorporate more iron-rich foods into our diet, such as liver, seafood, beans, or any of the food items listed in the slide. Another way we can increase our iron intake is by taking prescribed or over-the-counter iron supplements that will help boost our iron levels in our bodies. Also, choosing foods containing vitamin C can help to enhance iron absorption. So for prevention, sometimes we want to treat the cause of the blood loss itself, as blood contains iron within the red blood cells, and women with heavy periods are at risk of iron deficiency anemia, as well as those who suffer from chronic blood loss in the body from a peptic ulcer, a hiatal hernia, or colorectal cancer. And as mentioned before in the previous slides, diet is a big part of prevention. Reducing the amount of caffeine we take can be used as a preventative measure, as caffeine can reduce iron absorption for the body. Wearing proper shoes that produce the least amount of shock absorption to your feet can help prevent anemia. Wearing firm cushion shoes correlate with the physiological measurements, and wearing appropriate cushioning that reduces red blood cell abnormalities that runners experience. Also, having your coach or athlete be aware of the problem or potential problems can reduce the severity or even prevent hemolysis or iron deficiency anemia. Some additional information that we would like to share is that mild iron deficiency anemia usually does not cause complications. However, if iron deficiency anemia is left untreated, it can be severe and lead to health problems that include heart problems, problems during pregnancy, or growth problems.